Here is another video that I want to bring to your attention just to show where they're going with this testing, how they are going to manipulate you to pretty much have to take the test that they want so badly taken by everybody in the world. They are running all of these free events, these free drive-through testing. Drive up real fast, we'll test you, you'll get your results in 3 days.
Definitely more important than ever.
Harold Young, Orangeburg County Administrator, is working with local and state leaders to up free coronavirus testing in the county as he sees restrictions being loosened statewide.
We're seeing our cases and our numbers rise. If you've been following the numbers in Orangeburg County, we've posted some 10s, some 12s, some 9s, and every person that you see that is positive, by the time they go back and do contact tracing, DHEC and other organizations are telling us that you multiply those numbers by 9 because simply people have been infected.
Coming off the heels of a man who tested positive that had attended a church service in North, the administrator believes it's important for his residents to stay informed.
We've tested upward to 2,000 people, and that number is growing. Another culminating event, a big push of testing on next week on June the 2nd and June the 4th at the Orangeburg County Fairgrounds. We will have MUSC working with us as well as the local hospital TRMC. Testing will be completely free. It'll be drive-up and walk-up testing, so individuals can drive up and walk up, and they'll be tested. They don't even have to get out of their car, and they'll be there and available to assist. Our hope is to get through this pandemic with the least amount of deaths as possible.
They are ramping this up very, very high right now. They are doing everything they can to get you to test.
Testing is a critical piece in all of this, of course, but Shelby County hasn't had the capacity to test the number of people doctors said we should. Well, now we have reached the goal of being able to test 2,400 people every day, but nowhere near that number of people are being tested. So what's going on here?
Kentucky is setting the example for COVID-19 testing in the U.S. The Commonwealth has been offering free tests to any resident for nearly 3 weeks now, while more than half of the U.S. struggles to test those who are actually sick. WCPO 9 News reporter Courtney Francisco takes a deeper dive to find out how Kentucky is setting itself apart from the rest.
This is the closest we have been able to get to a testing site. Here, St. Elizabeth is testing about 300 people a day. The hospital says anyone who wants it can come get a test. I took it to confirm my health and help you understand more. Oh my gosh. That was...
Make sure your eyes water.
Doctors say if you want to save lives, you need to know who is infected and isolate them. And they say the U.S. is nowhere near being able to do that like Kentucky.
I think we're uniquely positioned in that the governor is really pushing to try to figure out how to reopen the state.
St. Elizabeth says these tests help leaders make those decisions by finding out who is infected fast so they can isolate and contact trace. Plus, the tests show how widely the virus is spreading.
One of the nice things is you don't have to have symptoms to come through and get tested. We'll test any Kentucky resident here.
It's free.
You'll get this back as soon as you're finished.
You'll pull into the tent.
I'm okay, a little nervous.
You might see medical assistant Danielle Thrasher.
Tissue. Make sure your eyes kind of watered.
She'll take your name and address.
Have you look straight ahead for me.
Then the nasal swab.
It's very, very specific. Not many false positives or false negatives. I'd say it's probably one of the better tests you can do.
St. Elizabeth Hospital says it has performed more than 14,000 tests in 3 weeks.
CVS is joining Rite Aid and Walgreens as a place for people to get tested for COVID-19. Senior health correspondent Monica Robbins explains what you can expect.
Starting tomorrow, you'll be able to get a COVID-19 test at a local CVS. Those interested need to meet CDC state and age guidelines and must register in advance at CVS.com. The test sites are in 13 Northeast Ohio cities. Then you're just going to drive up to the pharmacy drive-through window where you'll get the kit and instructions. You'll need to do the swab yourself in your car, but a CVS employee will watch to make sure you do it correctly. The test will then be sent to to an independent third-party lab for processing and send back results in 3 days.
All of the swabbing will happen at the drive-thru in the patient's vehicle in order to maintain safety of the patient as well as those of us in the store.
More than half of the company's 1,000 test sites across the country are going to be in underserved communities measured by the CDC's Social Vulnerability Index. Now, the index includes poverty, lack of access to transportation, and crowded housing that may weaken the community's ability to prepare and recover from coronavirus.
Hundreds of people possibly exposed to the coronavirus after someone who attended this Memorial Day weekend party tested positive for COVID-19. Now the county health department says the partier was likely incubating illness and possibly infectious on Saturday and Sunday at multiple party spots, including Backwater Jack's, Buffalo Wild Wings, and Shady Gators, even the taxi ride home. Everyone who was there now asked to monitor for symptoms and to self-quarantine. In Alabama this weekend, water parks reopened. The numbers are on the rise. 5,000 more cases in the last 2 weeks. In Montgomery alone, confirmed cases tripled over the last month.
When you consider that type of steep increase, it is cause for alarm, it is cause for concern, it is cause to understand that we are still in a crisis.
And as New York City announces it will reopen June 8th, Governor Cuomo focused on controlling city hotspots and readying hospitals to deal with a potential second spike.
The public hospitals cannot handle any outbreak of any size. We've learned that.
The state reporting its lowest death toll yet for 2 straight days. And for California's churches, a setback. In a 5-4 decision, the Supreme Court sided with the governor of California, allowing Newsom's restrictions on church attendance to continue.
We are obviously disappointed, but we are not defeated.
And one of the ways that they are using it is they are going to use the church.
Are you experiencing any fever or any flu-like symptoms today?
She's part of a major effort to bring COVID-19 testing to Dallas's southern sector. Volunteer Alicia Trusty says people started arriving at Friendship West Baptist Church's Keast Boulevard location first thing this morning.
Often people who reside in this area are already lacking health care, lacking access to resources. It was important that we bring the resources and the testing to them.
This program called Together We Test was put together by Project Unity, a faith-based nonprofit that works to build and sustain communities. Community leaders, churches, and medical professionals are now coming together to provide free COVID-19 and COVID-19 antibody testing.
They have the capability of administering 250 of each test per day. People should be in and out within 30 minutes.
I just believe that the faith community is a vehicle by which we can galvanize and get more people tested.
There are those in the community who have said to me, I am not going to those institutions out there because we don't trust them, but we do trust the church. So the least we can do locally is take this into our own hands.
It's our just civic and moral responsibility.
In the coming weeks, Together We Test hopes to expand testing to 5 churches in the area, each offering testing 1 day a week for the foreseeable future.
We're seeing about a 50% testing capacity rate.
Chantel Leatherwood is CEO of Christ Community Health Services, which offers COVID-19 tests at 6 Shelby County locations. In an attempt to get more people tested, her team recently ramped up messaging and awareness.
We're reaching out to churches, pastors, community agencies about the need to be tested, the times that testing are available.
Shelby County health experts are hopeful that once 141 new health department positions, from lab technicians to contact tracers, are hired next month, more free COVID-19 testing will be offered to those with or without symptoms.
They know that most people that are aware of any of, the information about how this is not as it seems, it's not, how they say it is, those people are not going to go in and get tested. But most of them, maybe not most of them, but a lot of them have religion, okay? And so who do they trust? They trust their pastor. They don't trust the government. So now you have all these churches that are going out to their parishioners and telling them, come in, we'll give you these testing, and they make it like it's, safe. It's going to feel better for these people because it's their pastor that's telling them, to give this test, and it's the pastor giving them this test, and they trust them. So they are going to use the church against us. This is just another way they're going to get the testing done. Just as I made the report on yesterday, how they're going to use testing at all your emergency shelters when any type of a disaster happens. They continue to do these exact things. So we just have to pay attention to it, stay on top of this. I hope everybody is having a great day. Remember, stay in the Word daily. It will help keep you balanced, and it will definitely continue to show you that evil has no chance. That with Jesus, you have nothing to fear, no panic, and you will be able to fight back against this type of just pure power. That's all this is. They want to be able to control you and do whatever they say. Thank you all so very much. We'll talk to you soon. God bless.